Today we want to talk about Global Health Lecture Series number 8, the life expectancy by birth, country by country. And I had always reiterated that these documents are from the World Health Organization. We want to discuss from the 70th country down to the 80th country. Today we talk of Netherlands as having a life expectancy of 76.65. United Arab Emirates, 76.51. Macedonia, 76.47. Number 74 is Uruguay, 76.35. Saudi Arabia is 76.30. Poland is number 76 with 76.28. China has a life expectancy of 76.04. Tunisia has 75.78. Paraguay has 75.77. And then you have number 80th country, Brunei, with 75.74. Apart from all these countries and the life expectancy, I've always told you that there are social determinants, things that determine why some people live longer than others, why some countries are better. In the United States and some of these developed countries, they start looking at early child development. In looking at early child development, you discover that some of the mothers, even when the babies are inside their stomach, start teaching the babies how to read, how to do things. The idea is to ensure that a healthy baby is born at the beginning of time, and that baby will live a good life. But in some other countries, mothers don't even go to hospital. There is nothing like attention to the young baby. And how do you expect that person to live up to 80 years or 84 years as in Japan, or live up to 85 years as in Monaco? It is impossible. In Japan, for instance, they take time in thinking about the early mothers, how they are treated, so that when the child is born, that child is reared with the best of conditions. Apart from childhood development, which is early and where these mothers are supposed to take care of their young babies, you have social support network. The social support network must be very strong for people to live good life. If you go to countries where people fear each other, where people are running helter-skelter, there is no social support, people are not supporting each other, you don't expect them to live very long. These are some of the little things that add up why some people live up to 79 years in their life expectancy, and some other people in parts of Africa and part of Asia will die within their 40th birthday. Another situation you should look at is addiction. There are places we have addiction to drugs, addiction to alcohol, and so many dirty habits. Of course, when you fill up the body with all these drugs, with things that are not supposed to be there, you don't expect the person to live very long. I'm very sure you know about that. Addiction is a very bad influence on the body and has to be avoided. Then we have healthy food. People are supposed to eat healthy. When you hear people talking of dieting or people planning what they eat, for instance, if people have diabetes and in hospitals, if you see how they are treated, they are giving ways to plan what to eat, then you know that there is need to take care of the body. When the body is taken care of, then that person will live longer. Apart from healthy food, we have safety network. In some countries, I've always said safety is not there. In some of our countries like Nigeria, like Ghana, Sierra Leone, some of the African countries, there is no safety. And when there is no safety network, you should know that people are going to be hiding all along, and some are not going to live long. Some die very young, because these are attributes. Then you have housing. What type of place do people live? What type of situation? You have public housing, you have people living in slums, you have people living in good places. Of course, people who live, for instance, in Denmark or Norway, if you see where they live, they are very cozy environments. You don't expect such people to die within their 30th birthday or thereabouts. They live longer, and that is what we should be gunning at. You also have gender. Disparity when it comes to treating people also affect health. Oh, we are treating women better, or we are treating children better, or we are treating the male better. Whatever the policymakers have designed will affect the health system and need to be seriously reconsidered in almost all countries. You also have race. Of course, the race disparity is a problem. You have this question of white and black. If you are in the United States, where did you come from? Are you an African American, or are you a white? Or even in our own countries, over countries in Africa and some other places, there is still that race issue. Which tribe you belong to, and you are fairly treated. These are problems when they rear their ugly heads, will affect the health of people. Because with race, some people don't even have access to insurance, they are not well treated, they don't go to the hospitals, they don't have access to care, and in the process, they die younger. Then what of disability? In our own countries over there in Africa, if somebody is disabled, they will just look at the person and start laughing at the person instead of taking care of the person. But the most developed countries, the disabled people, they have their separate parking lots, they behave differently, they are well catered for. When you build their houses, you have to make a way and ensure that they have access into those kind of places, especially government buildings, where they go to hospitals. Disabled people are supposed to be well taken care of. And that is why you see also disabled people in the United States, in Japan, in Netherlands, and some of these places living as long as 80 years, 90 years, not because they are disabled, but because they are well taken care of. Of course, you have lastly ideological influence. Ideological influence really dealt with Russia when they broke away into pieces, and that affected the lives of the people and the lives and life expectancy of people within all those areas: Bosnia, Russia, Czechoslovakia, and the rest of them went very, very down. The health system became disorganized. People could not control it. So ideology is also very important. How you look at issues of health, it has to be considered seriously by policymakers. When these things are taken into consideration, then we would have been moving towards greater health, not only in developed countries, not only in the United States, not only in Japan, but also in some of the underdeveloped countries. Thank you.